I'm here to talk about our programs that we've been carrying out at the Alaska Native Tribal Health Consortium over the last few years to provide some interventions for worker safety and health in rural Alaska. Some of the big challenges obviously are around transportation and the remoteness of the villages in rural Alaska. So most of the villages you have to fly out, take a couple flights even with your last flight out to whatever community, being by a single engine airplane or on a skiff, or maybe even if you're lucky on a snow machine. So transportation comes into play with everything you're doing out there, whether it's providing training, bringing materials or resources or food, or even safety equipment. After that, there's a lot of economic issues. There's limited cash economy in rural Alaska. A lot of communities rely on subsistence living, and that can make it hard when you don't have regular employment to learn all the skills that you need to work safely. So that's another big one. And then I think finally is the access to care, but also the access to safety and health resources in general. So when workers are injured, they don't have an occupational medicine provider that they might go see to help get them back on track and back to work safely in a short amount of time. I work to ensure all of our rural construction projects are carried out safely, but that gives us an opportunity for some extra outreach in the communities where we're working. So what we've been doing over the last 2 years is delivering some additional training where ANTHC has been awarded a OSHA Susan Harwood grant, and the target workforce for that is the rural Alaska Native workforce. So, our key groups are the utility workers and our construction workers, including housing, utilities, construction, and the other infrastructure that comes into play in rural Alaska. And I think what we need to improve it and make it more sustainable is we need to better define the burden of injuries and illnesses in rural Alaska Native communities so that we can start looking at areas to focus on, whether it's ergonomics or excavation and trenching. We need to sort of prioritize some of the interventions we undertake. I think it would go a long way if we could define what the current burden is, and then 5 years or 10 years down the road, be able to see if we did make an impact with the interventions we're delivering. Having the strategic plan going forward will be pretty valuable too, in terms of helping prioritize work areas to undertake, and having a published document to reference as different groups put in applications to try and get funding or to work with private partners for improving or building sustainability into their programs. I know from my perspective, a lot of that information is going to help with the programs that we're working on in Alaska for Alaska Native people.